So I'm going to be real with you now. In the past 3 weeks, I have two male family friends who have had heart attacks. Both are in the hospital having stents put in. They're in their late 50s. And 3 years ago, my best friend passed away after he suffered with a sudden heart attack in his mid-40s. Now, for some reason, we keep hearing of a lot more younger people, especially men, suffering with heart issues. But why is this? Let's find out from Dr. Upendra Shah. He's a cardiologist at International Modern Hospital. Welcome to the show, Doctor.
Thank you very much for inviting me on your show. And good afternoon to all your listeners and all your customers over there. Thank you very much.
Thanks, Dr. Shah. Let me ask you a question, Dr. Shah. Are you seeing more patients, especially younger people, with heart issues, angina or heart attacks right now?
You are absolutely right. Of late, now last 20 years, we are seeing the younger populations are coming with the heart attack. And more younger people are now suffering from angina or the heart attack. This is, we have noticed since last, I say, the 2 decades, maybe around early 2000, we started this trend. Particularly, this is what I call the area is the Indian subcontinent, definitely. When I may say Indian subcontinent, India, Pakistan, Bangladesh, we see, and even other countries also now the trends are a little bit showing that increasing number of the patients are coming with a younger age. This is obviously last 20 years, this is observation going on.
So what do you think is contributing to this first and foremost?
To be very honestly, what is the reason the younger age are coming? We are not able to really find out. But then the commonest cause, I understand, probably it is like the younger age, the people are having high blood pressure, diabetes, cholesterol, of course, smoking, sedentary lifestyle, and
I suppose stress and anxiety plays a part because we see a lot of younger people struggling.
Yes, that's stress and anxiety. Yeah, you're right. Absolutely, I agree.
So obviously, as I mentioned in the introduction, I know 3 people who've had heart attacks. My best friend passed away a few years ago. 2 of my family friends are currently in hospital out of the blue. Healthy people, obviously we don't know what was going on in the heart. They're having stents as I speak in the hospital right now. And one of the questions I asked my family member was, have they ever had COVID? Because I've heard of long COVID affecting the heart too. Do we know anything about this?
There are definitely, our medical literature definitely shows there are some increased incidence of heart problem, particularly coronary artery blockage with the COVID patients who have already suffered previously COVID. There is little increased trend is there definitely. But otherwise also, I tell you, COVID has little bit played a part. But otherwise also, we have been seeing patients coming at a younger age. So this is definitely we have to keep it in mind. And at least important thing is there, as I told you, those patients, now previously, once upon a time, we were not going for any health checkup regularly. But now as early as the 25 and 30 years, person should have the at least basic evaluation, cardiac examination by the cardiologist along with that ECG, and then the at least checkup of the lipid profile, blood sugar. These are mandatory things which one has to really check it, okay? Because many times these problems goes unnoticed for many years. Yeah. So I think that is an early little bit evaluation is required.
It's interesting you said this. I actually had a full blood test this morning because I've got a doctor's check next week and she needed all the results. How often should we be having regular blood tests? Like 6 months, once a year?
At least as I told you, if anybody, at least to start with as early as the 25, 30 years, one has to start doing that. Particularly if those people who have in family history of a heart problem or diabetes or high blood pressure, then definitely person who is smoking also should have this evaluation should be done once. And afterwards that, at least minimum, depending on the reports, either 6 months to at least 1 year, the at least blood check should be done.
And Ali's text saying, what type of checks are needed exactly? You were saying the lipid and the blood test. Do we need a scan as well of the heart?
Now, see, the most important thing is, I'll tell you, What one would like to know is that a blockage is there in the heart or not. So apart from the blood test, ECG and examination, what is the next stage is generally requires is a echocardiography just to see how the pumping of the heart. Then either the treadmill is the same, or maybe nowadays the trend is there that many people do ask for the CT scan and the calcium scoring. Okay. Now some people definitely prefers the treadmill. Some people prefers the CT coronary angio and maybe the CT scan to just do the calcium scoring. Both are good. I think the people have differences in opinion, and both the trends are going on world over.
So it's interesting you talked about the CT scan. So I have extremely high cholesterol, and we think it's genetic because I eat normally and everything, and I don't want to take statins. I've tried alternative remedies because I try and avoid statins because of the side effects and everything, but when I take them it goes down straight away. So my doctor said to me, okay, let me do a CT calcium score, which I did not know what that was. When they checked it, it was completely clear, which meant that even though I had high cholesterol around the arteries, it was fine. So this is what I was thinking. There needs to be proper checks, really, because people are taking statins and tablets for high blood pressure and cholesterol when maybe they don't really need it, do they?
I think I really appreciate the excellent question you have asked. Okay, and this is the common many times in my practice people come. I think there are one or two things. What you said for the cholesterol, I will just, the same answer will be for the patients who are diabetes, particularly may not be very severe one, but diabetes is there, or the borderline diabetes situation, particularly diabetes when the full-fledged is there, or a patient has a high blood pressure but they don't have any problem. The question is simple. One is, of course, evaluation, as you said, that the blockage is there or not, that high cholesterol. Yeah. Second thing is that why should we take the medication if we don't have any problem?
Yes.
That is the commonest question which arises in the patient's mind. And I do appreciate that is a right. They are right from their side. But then what I generally explain, I will take little 30 seconds to 1 minute to explain.
Please do.
When person does not feel anything, does not mean that changes in the body at the micro level, cellular level, are not going on. Their changes are constantly going on. See, if blood pressure is high, heart will have to pump little more. Heart will have to pump for against 120, 130 pressure to the 180, 190 pressure. Definitely, heart will have more stress. Similarly, all the vasculature of the body, the heart arteries, all the arteries, they will also have a more wall stress because of the pressure is high. So there is the inner lining of the all blood vessel gets micro damage, and that is how the blockage starts. The same thing is if the cholesterol not treated, person may not have any problem, but it will be definitely, these all changes will occur. Diabetes is also known to aggravate the blockage everywhere in the body, heart, brain, kidney, everywhere. So one has to remember, person may not get any problem. Even as you said, the coronary angio may be absolutely clear. That does not mean that if the high cholesterol is there, it should not be treated. It should be treated. Yeah. Blood sugar also, if the high treated, pressure also be treated. There is one important sentence I tell all the person does not feel does not mean that changes are not going on body. And there is one very nice sentence I tell to all my patients. When we drive a car, there is a front gear and there is a back gear. In body, there is no back gear, no reverse gear. The changes to bring it down to reverse is very difficult and many times late. So it is better to postpone or prevent the problems. Okay. Yeah. Better word is postpone the problems. Okay. So I think your question I have already asked and you understand. Yeah. Though it is normal, high cholesterol we have to treat. Blood sugar also we have to treat. Blood pressure also we have to treat. Second thing, we are not treating only for the cholesterol with the statins, but it definitely prevents or reduces the rupture of the inner layer of the artery. That is called the plaque rupture. And that is the plaque rupture is the commonest cause of this younger patient who gets this. It is a plaque rupture. So it is definitely useful for the reduction of the cholesterol, but it's equally important for the plaque rupture. And plaque rupture is the main cause of all these heart attacks and other things. Okay. So that is 30% reduction is by the statin. So that I agree that person may have some side effects, but should be adjusted dose, and one compared to other statins, if it works out, that is the better one.
Okay. David said, are men more susceptible to heart attacks than women?
Yes.
Why is that?
Particularly, generally we say that medical science says that in a female, up to the menopause, there are somehow some protective effect of the hormones. That's why the men are little more. Otherwise, also, incidence of the men getting a coronary artery disease is very young. It's higher than the female. But let me tell you one thing, that all female also should have an investigation, and whenever they get a female gets a coronary problems, that is sometimes more severe. Heart attacks, more complications, other things. So I think equally important to evaluate in a female patients also, and they should also take care as good as the men. Like that.
So we've had a text come in saying, there's no name on this, saying this morning about 6:30 a.m. I was lying in bed looking at my phone when I developed a really bad pain in the back of my neck. It was so bad that I actually started crying. I also started sweating and I felt sick and I felt like I couldn't breathe. The pain then moved down across my shoulders to my back and it felt very sore when I breathed in and out. So I managed to go downstairs, take some liquid ibuprofen. It got better after about 10 minutes, though I still felt very lightheaded. Saw a doctor this morning at 9:30. He checked my blood pressure, slightly off, but apparently normal. Oxygen stats were okay too. But when I went home, I did the bad thing and I looked up Dr. Google and it was showing me that it's all signs of a heart attack. Should I be worried? I'm in my late 40s.
It's a very good question. Commonly, I will answer in this way. There's a question: how the heart attack or how the chest pain related to the heart presence. Generally, it is a chest pain which is retrosternal behind the central bone, or maybe in any part in the chest. Maybe sometimes the pain will radiate to the left hand or the right arm. Sometimes only the arm or the shoulder pain can be there. Sometimes the pain in the back also can be there. May not be the pain in the chest, in the front. Okay, so these are the very, very different ways of presenting as a heart problem with angina or the blockage artery pain generally presents. In a very broad level, we say one has to be very high suspicious of that to evaluate that whether this pain is related to heart or not, or coronary artery blockage or not. And excellent. So anytime any discomfort is there, like such thing is there, person should go to his doctor, take at least ECG and do the troponin. These are two very important tests. That is how we have to evaluate the chest pain. ECG, troponin, then afterwards, later on, if both are normal, then can be echocardiography, and of course, then I told you either treadmill or the CT scan. And if there is anything is positive, suspicious, then definitely the invasive coronary angiography comes. If there is a strong indication, a strong signs of blockages in the coronary artery, or sometimes the ECG showing an attack, then immediately patient goes for the emergency admissions and then the invasive coronary angiography. And if the attack is there, then the angioplasty is a must.
Okay. And Dr. Shah, very briefly, because we're running out of time, if we're with somebody and they actually are having a heart attack, what should we do and what shouldn't we do? Obviously, before the ambulance comes, is there anything we can do?
Yeah, that means particularly commonly many times, at least person should lie down, or if driving a car, take the car aside and then call and then keep at least the glass open, and then he should rest over there. Then if obviously somebody should be around there, and one has to see till the ambulance comes, and then ambulance person, they will definitely, by and large nowadays in UAE everywhere, a very good ambulance team, and then they give the immediately patient the aspirin, and so that is what that.
So you're saying we should keep them lying down, basically?
Basically, yes.
Okay,
till the things are being confirmed or ruled out.
Okay. That's Dr. Shah. Thank you so much for joining me. He's a cardiologist. You can find him at International Modern Hospital.
You've been listening to a Dubai Eye 103.8 podcast. To enjoy lots more from Dubai Eye in the United Arab Emirates, just go to DubaiEye1038.com. or find them wherever you normally get your podcasts.